Hi friends, Dr. Nancy Trimbley, putting the power and knowledge of your health back in your hands. At the special request of one of our YouTube followers, we are doing this video today on cranial sacral at home on yourself. And the request was to how to do this when you're laying down. And it is true, sometimes you can wake in the middle of the night either with a headache or neck pain or anxiety or sleeplessness, jaw pain, sinus issues. And doing this cranial sacral therapy on yourself not only will relax you, but also can be very therapeutic to helping you to heal some issues. So what I'm doing is I'm laying on my back with a pillow beneath my head, similar to what you would be doing in bed. I have another pillow, and these are both throw pillows. Of course, I wouldn't be sleeping on this, but it is supportive of my neck. And I have this throw pillow, which is easy to grab in the middle of the night. The reason why I have the throw pillow on my chest is because I want to support my elbows, because it's really hard to hold your arms up in the air for any length of time. And we need to hold these positions, the contact positions on our cranium, for a few minutes on each one. Just as a disclaimer, I am not a certified cranial sacral therapist. I have not done any of the Upledger courses, which is what I recommend you do if you want to learn how to do this either as a professional or a layperson. I learned cranial sacral in this form from Dr. Carol Phillips, and this was a course through the International Chiropractic Pediatric Association. And I've been doing this technique in my office for decades with awesome results with our patients, and also doing it for myself on my own. We're only going to do a few of the points, but these are actually different than the points I taught you in our original cranial sacral at home video. So what I want you to do is first support the elbows with that pillow, and this first position at the frontal bone, I want you to think that you're lifting this bone off of your cranium. Your contact point is this bump right here on each side. This is part of the frontal bone. We're going to use that as a ledge to lift. And remember, the pressure that you're using is only the weight of a dime. So it's very light. We're not pressing in, we're lifting gently. So I'm just going to hold that position like that. And in my original video, I said to hold it for 4 minutes. Honestly, that's really not possible when you're laying down, just because your arms will get very tired. So hold this position anywhere from 30 seconds to 2 minutes. And you might feel, if you're very in tune, you might feel a little bit of movement in that frontal bone. You're going to hold that position just like that, just sustained, extremely light pressure. I don't even want to call it pressure. I want to call it a lift. That's going to be your first position. The next position is going to be the sphenoid, which the dip in the temple, that's your contact point. And this also is a lift up. You're aiming your fingertips towards the ceiling, not in, but towards the ceiling. So really it's the side of my index finger that is on the dip of the temple right there. And again, anywhere from 30 seconds to 2 minutes. And you might feel a little bit of a wobble from left to right, and that's great if you can feel that. You're in tune with the motion of the cranials. The next one is to give your arms a relax. Normally I wouldn't go to this one right away, but this is the temporal bone. Your ear sits in the temporal bone, and the angle you want to pull on your ear at is downward at a 45-degree angle. So you're going to just gently actually use the weight of the gravity of your fingertips on your ears, inside your ear right here. And again, 30 seconds to 2 minutes like that. And make sure you're deep breathing as you do all of these points. A good thing to do in addition when you're using any of these points, but especially this temporal bone, is to put your tongue on the roof of your mouth. That is the hard palate. That hard bone that you feel is the hard palate. And when you put pressure on that with your tongue, you're actually helping your cranium to regain its normal mobility and alignment. And deep breathe, anywhere from 30 seconds to 2 minutes. The last one I want to show you is new for this video, and it is the nasium, and it's right here. It's a small bone that sits at the bridge of your nose. So the way we're going to work that is to put one finger on your forehead between your eyebrows, and the motion is to go up. That's the gentle pressure you want to use. And the other one is on the bony part of your nose right here, and that one is down. That's the gentle pressure we're doing. So I'm going to tilt my head a little bit so you can see it better, but I'm just basically just pulling my fingers gently apart. It almost feels, it will feel like you're just pulling the skin, and that's great. That's the amount of pressure you want. You don't want to use deep pressure. You just want to use this light, gentle pull. Put your tongue on the roof of your mouth at the same time. Now, very often, if you're doing this at night when you're laying down, you'll maybe be asleep by the time you get to the point where you're doing the nasium. But if not, that one can really release a lot of pressure. That helps. Bye for now. And by the way, if you like what you hear, put a comment below. If you need clarification on what I've said, put a comment below. If you think some of the words I say are funny because it brings out the New Yorker in me, put a comment below. And be sure to hit that notification bell so that you can know when our new videos come out and we have upcoming good stuff. And be sure to subscribe and share this video. There's other people out there like you that need help. So give them a hand so my reach can get bigger. Bye for now.